everyone, I am Mariah Angela F. Pineda, a student from BS Nursing 2 in College of Our Lady of Mount Carmel. So the procedure that I'm going to perform is PA Gen bag technique. It is a tool in which the nurse during her visits will enable her to perform nursing procedure with ease and deftness. So for the purpose, it is an essential and indispensable equipment by a public health nurse in which she has to carry along with her during her visits. So upon arriving at the client's home, we have to greet and introduce ourselves to the family. So hello, Family Ramos. I am Mariah Pineda from College of Our Lady of Mount Carmel. Then we have to assess the client's needs, establish rapport between the members of the family to promote cooperation, and then identify the client and explain the procedure to the client. Then ask for the client's history. Then, ask them if they have any flat surface like table, chest, or box, and if none, we can utilize the floor. So in placing our bag, we have first to prepare the plastic lining. Making sure that the clean side is out and the folded part is touching the table. Then prepare for the clean paper. Again, making sure that the clean side is out and the folded part is touching the surface. Then we're going to place our bag at the left corner, making sure that the straps is under the bag. And the rationale for this is to prevent the bag from being contaminated. Then ask them if they have running or tap water, and if none, we can ask for a basin of water or a glass of water. Rationale for this is to be used for hand washing. And then, open our bag and get the towel and soap with the soap dish. And again, close the bag to prevent for contamination. And the rationale for this is for preparation for hand washing. Then wash our hands with soap and dry them thoroughly with towel. Rationale for this is to prevent contamination and infection from the care provider to the client. Once done, we're going to place it again here. Then again, open the bag. Then take out the apron and put it with the right side. And the rationale for this is to protect the nurse's uniform. Now we're going to put out all of the necessary articles needed for the specific care. And the rationale for this is that it will be easily accessible. So assuming that the specific care that I'm going to perform is wound dressing, so again I have to take out all of the necessary materials needed for wound dressing. Then, we have to close our bag and place it at one corner on the working area. And the rationale for this is to prevent for contamination. Then, proceed with performing the nursing care. And the rationale for this is to give comfort, security, and hasten the recovery. Once done, after the nursing care, we have to clean all of the materials that were used and wash our hands. Then put it at the clean side of the table. So this will be the clean side and this will be the dirty side. Then again, we have to perform hand washing. And the rationale for this is to protect the caregiver and to prevent infection. Then, again, we're going to open our bag. Then put the materials in their proper places. Then we have to remove our apron, holding it away from the person, and the soiled part should be in. Fold it. Then place it at the proper plastic receptacle. And place it again in the bag and close the bag. Going to get the bag again. Hold it. Then fold the lining. Place it at the plastic receptacle. Fold the plastic. Place it at the plastic receptacle. Then discard. And then, take the record and talk with the mother. Write all of the important data like the observations, nursing care, and the treatment rendered, and then give instructions of care to the patient in the absence of the nurse, and make an appointment, either home or clinic visits, and take note of the date and time, and the rationale for this is to prepare for a follow-up care. And that would be all for PHN bag technique.